Okay, before we begin this video, can you please verify that you're over the age of 18 and you give consent to be filmed?
I'm over the age of 18 and I give consent to be filmed.
Okay, thank you. Let's go ahead and begin. Knock, knock, knock. Hi, I'm Bella. I'm going to be your student nurse today. Is it okay if my instructor joins us for your head-to-toe assessment today?
Yeah.
Okay, thank you. I'm going to go ahead and provide us some patient privacy, and I'm going to go ahead and wash my hands. Can you please verify your name, your full name and date of birth?
Travis Ledkemiller, 3993.
Okay, thank you so much for that. And what gender were you born as?
Male.
And what do you identify as?
Male.
Okay, perfect. And what are your pronouns?
He, him.
Okay, thank you. So what brings you in today, Travis?
Just a normal checkup.
Okay, great. And do you have any other secondary diagnoses we should know about or any other health concerns?
No.
Okay, perfect. Do you have any allergies?
No.
Okay, perfect. Do you know your most recent weight?
260.
Okay, and what's your most recent height?
6'4".
Or your height? Okay, thank you so much for that. How's your mood today?
It's good.
Okay, and do you have any stressors in your life right now?
Just coaching football.
Okay, and how do you cope with that?
A hot shower.
Okay, great. And I know this is a strange question, but do you have any thoughts about harming yourself or others?
No.
Okay, great. And are you in any pain today?
No.
Okay, great. So then your goal pain would be,
Same. 0.
okay, so on a scale of 0 to 10, 0 being no pain, you would like your pain to be a 0?
Yeah, 0.
Okay, perfect. So I know I already asked you this, but if you can just confirm one more time your full name.
Travis Ledkemiller.
Okay, and where are we, Travis?
The hospital.
Okay, and what are we doing here?
Getting a checkup.
Great. And do you know about what time it is?
About 8:30.
Great. And can you please say or repeat the following phrase, good morning?
Good morning.
Okay, thank you so much for that. So I'm going to go ahead, if it's all right with you, start the assessment. So we're going to start off, if you can please grip my fingers. Okay, perfect. Thank you so much. So the strength is equal bilaterally and everything feels normal. I'm also going to go ahead and take a look at your eyes if that's okay.
Yeah.
Okay, so if you can just look at the tip of my nose for me. Okay. And your pupils are constricting normally. Okay, and those are pink and moist, so that looks great. Now I'm going to have you look at the tip of my pen. Oh, just look at the tip of my pen. Okay, and once again, just look at the tip of my pen with your eyes. Do not move your head, please. Okay, thank you for that. You're able to follow without moving your head, so that is great. Now I'm going to go ahead and assess your head, so if you could take off your hat for me, please. Okay, so it feels symmetrical. I don't see any abnormal lesions. It looks great. Now I'm going to go ahead and take my pen light out again, and I'm going to go ahead and look in your ears. Okay, and I'm going to look in your other ear, please. Can you turn your head for me a little? Okay, and I'm not noticing any excess cerumen, which is great. Now I'm going to look in your nose, so if you can look up. Okay, and I don't see a deviated septum. I don't see anything crazy going on up there. It looks about normal. Now I'm going to assess your neck, so if you can just look up for me. That looks great. Feels normal. And now I'm going to go ahead and look at your throat. So if you can just open up for me. You can move your tongue up, down, side to side. Okay, thank you so much for that. And now I'm going to go ahead and assess your heart, if that's okay. Actually, before I do that, I'm going to take your vitals. So we first starting with your blood pressure. And can I steal a pillow from you, please? Lift your arm up for me one more time. Okay. Okay. And I did get 123 over about 82, which is amazing. That's almost a normal blood pressure, which is great for you considering it's normally high. So now I'm going to go ahead and take your temperature. My thermometer says you are running a tad fever. Okay, getting a little more normal. Saying about 99.3 for me. You might have a slight fever. It could just be from the hat. It is also pretty warm in this room.
It's very warm.
Okay. And now I'm going to go ahead and check your oxygen, your pulse ox. Okay, and your oxygen is 95%, and your heart rate is 80, and that is 95% on room air. You're not on any oxygen, which is great. Now, if you don't mind me using your cell phone, I do not have a watch. I'm just going to be using the stopwatch here. Okay, and for your respiration, I got 19 breaths per minute, which is normal, so that is great. And that is your vitals. So now I'm going to go ahead and I'm going to look at your heart if that's okay. I'll move that over there now. So the first thing I'm going to be listening to is your aortic. If I can lift your shirt, please. Okay, and I'm hearing a normal S1 and S2. Now I'm going to be assessing your pulmonic. I can also hear the S1 and S2, and the rate of your heart is so far normal. Now I'm going to look at the Erb's point. Okay, same thing. Oh, now I'm going to be looking at your tricuspids. Okay, and that sounds normal. S1, S2, normal rhythm. Now I'm going to be assessing your mitral. Okay, and that all sounds amazing. I heard the S1, S2. The rhythm is normal, so that's perfect. Now I'm going to go ahead and test your capillary refill on the upper extremities. Okay, and the refill is less than 3 seconds, which is great. Okay, and I'm going to do that in the lower extremities as well, so if you don't mind taking your socks off for me, please. Okay, I'll be testing the same thing. Okay. Okay, and the capillary refill on that was also less than 3 seconds, which is normal. Now I'm going to be assessing the heart rate on your extremities bilaterally. And that's even, so that looks great. I'm going to be doing the same thing. Okay, and that looks great. It is equal bilaterally, so that's perfect. Now I'm going to also look for edema in your upper and lower extremities. Visually, I'm not seeing anything, but I will go ahead and palpate, and I will check this as well. I'm not seeing any pitting. Now I'm going to assess your legs for edema. And I'm also not seeing any pitting. No edema. Okay, no edema on any of the extremities, which is amazing. Now I'm going to go ahead and I'm going to listen to your lungs if that's okay. So if you can go ahead and lift up your shirt for me one more time. And now when you feel this touch your skin, if you can please take a deep breath. Let me know if you need to stop. Take a deep breath. If you can please take a deep breath once you feel it touch your skin, that would be amazing. Take one more deep breath for me. One more time. Okay. So I did not hear any wheezing or any notable abnormalities, so that looks great. If you can please sit up for me, I'm going to listen on your backside. And once again, if you can please take a deep breath when you feel me touch. Okay, thank you so much. So once again, I did not hear any wheezing or anything like that, so that all looks amazing or sounds amazing. Now, do you have any coughs? Do you cough?
No.
Okay, and do you ever have any sputum, like anything that comes up at all?
No.
Okay, perfect. Well, now I'm going to go ahead and I'm going to assess your abdomen. So once again, if we can lift your shirt, that would be amazing. Okay. So as I'm looking at the abdomen, I don't see any abnormal lesions. It looks symmetrical. It looks great. I'm going to go ahead and palpate. Does this hurt at all? Are you in any pain?
No. No.
Okay, perfect. Well, now I'm going to go ahead and I'm going to listen to your bowel sounds.
Really?
Yes, can you actually please lay a little bit flatter for me?
This
Is this comfortable for you?
whole tradition stuff.
Are you comfortable?
I'm comfortable, yes.
Okay. Okay, great. So that sounds normal. It's not hyperactive or hypoactive. It is normal and functioning properly. So that is great. Now I'm going to ask you a few strange questions. If you'd like to sit up, you can. So can you tell me when the last time that you had a bowel movement was?
About an hour ago.
Okay. And how often would you say that you have a bowel movement?
2 to 3 times a day.
Okay. And when you do have a bowel movement, are you able to go by yourself? Like, do you have any accidents?
No, I go by myself.
Okay, great. And when you last used the restroom to have a bowel movement, what was the color?
Brown.
Great. And what was the consistency? Was it formed, loose?
Normal.
And what would you describe as normal? Like
Firm.
firm? Okay, great. Um, and are you able to pass gas okay?
Yeah.
Okay, perfect. Um, Now I'm going to go ahead and ask you some more questions about urinating. Right away, I'm not seeing any catheter, which is great. So are you able to use the restroom to urinate on your own? Do you have any accidents?
I use the restroom by myself, and now I don't have accidents.
Okay, great. How often would you say you use the bathroom to urinate a
Like
day?
8 to 10 times a day.
Okay. And when you urinate, is there any pain?
No.
Okay. And what's usually the color of your urine?
Uh, Light yellow.
Okay. And is there any odor?
No.
Okay. Um, I think that's all my questions about your urine. Um, so now I'm going to go ahead and have you um, sit on the edge of the bed for me, facing me. And we're going to be looking at your range of motion in the upper extremities first. So if you could please put your arms like this, put your arms like this. Perfect. Now if you can wiggle your leg in a circle. Okay. Perfect. Now we're going to go ahead and test this strength. So if you can please try to push my hands out. Okay. And try to push my hands in. Okay, perfect. And now I'm going to be testing the strength on the lower extremities. So if you can please go ahead and push up for me, push down, push out. Okay, please push in. Okay, so on the upper and lower extremities, the strength is equal bilaterally. I didn't see any issues with that. And have you had any falls in the last 6 months?
No.
Okay. Do you use any assistive devices like a wheelchair, cane, walker?
No.
Okay. Do you feel comfortable walking for me today?
Yeah.
Okay, so please go ahead and walk across the room. Okay, thank you for that. You can go ahead and have a seat.
Like normal? Or like this?
Short, like normal is fine. Okay. So I noticed that your gait was normal. I didn't notice any limping or anything like that. Your posture was also great. So that's great. Now I'm going to go ahead and I'm going to assess your skin. So if you can just put your legs out flat for me. So as I'm observing your skin, I don't see any wounds. I also do not see an IV that's in. I don't see any lesions. The color of your skin is normal. The temperature of your skin is a little warm, but nothing crazy. Your skin's not overly dry. There's definitely some moisture there. Let's see. I'm also going to check for the turgor in your skin. Okay. And I'm not noticing any tenting. Okay. And I'm not seeing any tenting, which is great. And I think that's it for my skin assessment and my overall head to toe. So, do you have any questions? Any concerns?
Nope.
Okay, perfect. Well, if you don't need anything else, I'm going to go ahead and give you your call light. Don't hesitate to push it if you need anything at all. And I will be in right away. I'm going to go ahead and perform hand hygiene before I leave. And I hope your day is great.
Thank you.